go for a cup of tea, thank you.
You're very welcome.
Everything okay?
I just received this letter. I don't know what it is about.
Oh, let me have a look. I've had one of these before. You've been invited to have a cervical screening test.
A what?
A cervical screening test is a test that could save your life. I always have mine when I am invited.
I'm glad that you know about the test.
The test is done by a nurse who checks the cervix, which is an area inside the vagina.
Oh.
They are sometimes called smear tests. I was worried about my first one, but it all turned out okay.
It sounds embarrassing. So, do I need to have one?
Oh, the nurses who do the tests were very nice to me and made me feel very comfortable when I had mine done. The choice is yours, but it is important, so I think you should get it done.
I was embarrassed in first, but when I get there, I was fine.
It's a really good test as it can help prevent cervical cancer.
Really?
It checks to see if you have HPV. If you do, you can have checks to see that you don't get cancer.
What is HPV?
HPV is simply an infection that is passed through skin-to-skin contact. This means skin-to-skin contact of the genital area with someone. Even if you're not sexually active, it is important that you have the screening.
Ooh, is the test painful?
When I had mine, it didn't hurt, but it felt a bit strange. A friend of mine said she felt uncomfortable, but not painful.
What is about if I am on my period?
You need to make sure you're not on your period of the day of your appointment.
Oh, I'm a bit nervous about going.
That's okay. Many people are. When I go to mine, I always take my support worker. She assures me and makes me feel comfortable when I'm having the test. I have a much longer appointment, so I can ask any questions before I have the test. The nurse goes through everything with me every time I go to have the test.
That's good.
When you book, you can tell the nurse you're feeling nervous. You can ask for more time or make another appointment. You can bring along your support worker, and you can even ask to listen to music to make you feel comfortable.
Yes, I think that may help.
It's important to have the test as it could save your life.
When I went to have mine, I had a lovely nurse who told me about it before I went to mine.
Hello, my name is Beth and I'm a nurse. I am going to talk to you about cervical screening. Cervical screening is an important test, so please come for it when you have been invited. Cervical screening is a test for people with a cervix. It's also called a smear test. I have an image here to explain where it is on the body. The cervix is inside the body, so you cannot see it. Having the test can stop you getting cervical cancer and saves thousands of lives every year. This is why it is important to have one. Of course, it is your choice whether you do or do not have the test, but we do recommend it. If it is your first time, I have a little bit of information about how often you need to have one. We will ask you to come for a test every 5 years when you are between the age of 25 and 64. You will get a letter through the post when it is your turn for the test, inviting you to book an appointment at your GP practice. You need to make sure you are registered with a GP, so you are invited for one. The reason we carry out the cervical screening is to test for HPV. HPV stands for human papilloma virus. It sounds like a lot of jargon, doesn't it? Well, HPV is simply an infection that is passed on from skin to skin contact. This is when you have skin to skin contact of the genital area with someone. Even if you're not sexually active, it's important to still have screening. Most people may get the virus at some point in their lives, but if you do, your body will fight the infection and will usually get rid of it. However, sometimes it does not go away. If this happens, it can lead to cervical cancer. When we give you a test, we can see if you have HPV and any changes in the cervix. If you do need treatment, this can stop cancer ever happening. Everyone with a cervix and at the age of screening will be invited for the test, even if you aren't having sexual contact with anyone. Most people will have a negative result. This means your risk of getting cervical cancer is very low. If you have a positive result, this means the virus has been found. If this is a result, you will be invited for another screening or for a closer look at your cervix. It is your choice to have the test, but we recommend that you do, so we can make sure that you stay healthy. You can bring someone with you for support, and we can make sure you have a longer appointment. You can ask any questions you have, and we can spend some time going through what happens in the test. I look forward to seeing you soon for your screening.
What are you up to today? Are you going to book your appointment?
Yes, I'm a bit nervous. I will speak to my support worker to come with me.
Well done. That's a very best decision.
You can ask your support worker to help you book your appointment.
Oh, okay. Yes, I will ask them to book it. Yes!
Well done.
I'm here to support you.
Thank you. Yes.
Hello, Isabel.
Hello.
Are you here for your cervical screening?
Yes.
And is this your support worker?
Yes, my support worker is Claire, yes. I'm a bit nervous.
Yes, she is quite nervous, so if you explain to her what's going to happen, help her feel more comfortable.
Okay, well, let me go through what is going to happen today, and then if you have any more questions, I will be able to answer them for you. Would you like to follow me through to the treatment room?
Yes, of course I will.
Okay, let's start by looking where the cervix is on your body. So this is your cervix.
That's for cervix, yes.
And it is about there on your body.
Okay.
So I will ask you to take your clothing off below the waist. We have a curtain we close to give you more privacy.
Yes.
The test is done on the couch with you lying down, and I will give you some extra paper toweling to cover yourself with to feel more comfortable.
Okay.
We can do the test with you lying down on your side or on your back. Then you will bend your knees and open your legs. Then I will use this tool to carry out the test.
Okay.
This tool is called a speculum. I insert it gently into your vagina so that I can see the cervix. Once it's inserted, like this one, I will open it up slightly and I will use a soft brush to take a sample from the cervix. The brush is very soft and it won't damage your cervix or cause you to feel any pain. This one is just for you to see. If you like, you can touch to see how soft it is.
Nice and soft.
And it won't damage the cervix or cause you to feel any pain. So when I take the sample, then I will send it off to be tested and see if any of the virus is found. This is important to know earlier rather than later, as treatment can help to stop a cancer growing in the cervix.
Yes.
There might be a little bit of bleeding after the test, but this is nothing to worry about and it should stop in a few hours.
Okay.
And you will get your results sent to you in a letter within 2 to 6 weeks.
Okay.
I will talk to you throughout the test and we can take our time. We can stop at any time if you feel uncomfortable. Please ask any questions along the way if you have them.
Okay.
Do you have any questions before we start?
And what if I get the virus?
Most women won't have the virus and won't need to be tested again for a few years. For the women who have the virus, the letter we send to you will let you know what will happen next. This might be another screening or it might be another appointment to take a look more closely at the cervix. There are some important things I want you to look out for in between the tests. Bleeding when it's not your period, or bleeding when your periods have stopped. If you have pain or bleeding during or after having sex, or if you notice any unusual fluids from your vagina. If you do have any of these, please contact the practice and we can arrange to see you again.
I do hope I don't get any of that.
It's good you don't have any of that at the moment, but if you do, let me know. We can make an appointment for you to discuss it.
Okay.
Most people do not have any of the things that I have just mentioned, but I must make sure you know in case you notice any changes. Do you feel ready to do the test now then?
Yes.
Okay. If you get undressed and let me know when you're ready.
Okay.
Does anyone want some soup?
Oh, yes, please.
Oh, yes, please.
Me too.
Have you got any bit words with it?
Yes, we have.
Didn't you go for your appointment for your cervical screening today?
Yes, I did.
How did it go?
So, really well, thank you. The nurse is really nice to me. I explained everything.
It is very important to have this test.
I have had quite a few screenings now, but I have never had any problems with mine. Yours will probably be okay as well.
Yes, you'll be fine. But earlier, if you find out, the better.
Thank you for helping me make my decision to go for my school screening test.
Remember, it's your choice, but I think you made the right decision.
I agree.
Thank you.
Aren't you going to get on with that soup, Rachel?
Yes, I would.